We've all been there. You're having a great day at the beach or by the pool, and before you know it, your skin is turning an alarming shade of red. But what exactly is going on beneath the surface when we get a sunburn? Well, at its core, a sunburn is your skin's response to ultraviolet radiation damage. When your skin is exposed to UV light, it triggers a response in your body. Your skin cells' DNA gets damaged, and in an attempt to prevent further harm, your body increases blood flow to the affected areas. This increased blood flow is what causes the redness we associate with sunburns. But it doesn't stop there. Your body, clever as it is, also releases inflammatory chemicals called cytokines. These little messengers are responsible for the pain, swelling, and heat you feel when you have a sunburn. They're essentially your body's way of saying something's not right here, and kickstarting the healing process. Now, you might be wondering about the difference between a regular sunburn and sun poisoning. While the terms are sometimes used interchangeably, they're not quite the same thing. Sun poisoning is actually a more severe form of sunburn. It goes beyond the typical redness and pain and can include symptoms that affect your whole body, not just your skin. Causes of sunburns. The main cause for sunburns is UV radiation from the sun. There are actually three types of UV rays: UVA, UVB, and UVC. UVC rays are mostly absorbed by the ozone layer, and thankfully, they don't reach us as they're the most harmful. UVA and UVB rays, on the other hand, do reach our skin and are the primary causes of sunburns. UVA rays penetrate deep into the skin and are primarily responsible for premature aging and wrinkles. They can pass through glass and cloud cover, which is why you can still get sun damage on a cloudy day or while sitting near a window. UVB rays, on the other hand, are the main cause of sunburns. They affect the outer layers of your skin and are more intense during the middle of the day and in the summer months. Your skin type plays a big role. People with fair skin, light hair, and light eyes are generally more susceptible to sunburns because they have less melanin, which is the pigment that gives skin its color and helps protect against UV radiation. Finally, UV radiation is typically strongest between 10 a.m. and 4 p.m., so you're more likely to get burned during these hours. Symptoms of a sunburn. The most obvious sign is, of course, the redness. This usually appears a few hours after sun exposure and can continue to develop for up to 24 to 48 hours. Along with the redness comes warmth. Your skin might feel hot to the touch. This is due to that increased blood flow we talked about earlier. Pain and tenderness are also common symptoms. Your skin might feel tight, itchy, or painful, especially when touched. In more severe cases, you might develop small fluid-filled blisters or larger blisters that can break open, increasing the risk of infection. As the sunburn progresses, you might notice your skin starting to peel. This is actually a good sign. It means your body is shedding the damaged skin cells and replacing them with new, healthy ones. However, it can be itchy and uncomfortable. Sun poisoning, as we mentioned earlier, is more severe than a typical sunburn. In addition to the symptoms above, sun poisoning can cause fever and chills, nausea, dizziness, and dehydration. You might experience headaches, confusion, and even fainting. In extreme cases, sun poisoning can lead to shock or even require hospitalization. It's also worth noting that the effects of sun exposure aren't always immediately visible. UV radiation can cause long-term damage to your skin, increasing your risk of premature aging and skin cancer. This is why consistent sun protection is so important, even if you're not prone to burning. Treatment for a sunburn. The first step is to get out of the sun as soon as possible to prevent further damage. If you're outside, seek shade or go indoors. Cool your skin down by taking a cool, but not cold, shower or bath, or applying cool compresses to the affected areas. This can help soothe the burning sensation and reduce inflammation. Keeping your skin moisturized is crucial. Use a gentle, fragrance-free moisturizer or aloe vera gel to help soothe your skin and prevent dryness. If you're using aloe vera, try keeping it in the refrigerator for an extra cooling effect. Drink plenty of water to stay hydrated, as sunburns can cause fluid loss through the skin. Over-the-counter pain relievers like ibuprofen or naproxen can also help reduce pain and inflammation. Be sure to follow the dosage instructions on the package. For itching, you might find relief with an over-the-counter hydrocortisone cream or an oral antihistamine. If you develop blisters, try to leave them alone. They're your body's way of protecting the damaged skin underneath. If they break on their own, clean the area gently with mild soap and water, and consider applying an antibiotic ointment to prevent infection. For more severe sunburns or cases of sun poisoning, you might need medical attention. Signs that you should see a doctor include severe blistering over a large portion of your body, high fever, extreme pain, headache, confusion, nausea, or chills. These could be signs of a more serious condition like heat exhaustion or sun poisoning. In some cases, your doctor might prescribe oral steroids or other medications to help manage severe symptoms. They might also recommend intravenous fluids if you're severely dehydrated. It's important to note that while these treatments can help manage the symptoms of a sunburn, they can't undo the damage to your skin cells. That's why prevention is so crucial when it comes to sun exposure. So how can you prevent sunburns in the first place? The most obvious answer is to limit your sun exposure, especially during peak UV hours. If you do need to be outside, seek shade when possible and wear protective clothing. Wide-brimmed hats, long-sleeved shirts, and long pants can provide excellent protection against UV rays. Sunscreen is, of course, a crucial tool in preventing sunburns. Choose a broad-spectrum sunscreen that protects against both UVA and UVB rays, with an SPF of at least 30. Apply it generously to all exposed skin about 15 to 30 minutes before sun exposure and reapply every 2 hours or after swimming or sweating. Don't forget about often overlooked areas like your ears, the back of your neck, and the tops of your feet. And remember, no sunscreen is completely waterproof, so always reapply after swimming or excessive sweating, even if the bottle says water resistant. It's also a good idea to check the UV index before heading outside. This is a measure of the strength of UV radiation for a particular day and location. The higher the UV index, the greater the need for sun protection. Remember, a tan might look nice, but it's actually a sign of skin damage. There's no such thing as a healthy tan. Any change in your skin color after sun exposure is a sign that damage has occurred. By taking steps to protect your skin from UV radiation, you're not just avoiding the pain and discomfort of sunburns, you're also reducing your risk of premature aging and skin cancer. Now we want to hear from you. Do you or someone you know have sunburn before? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.